Hello friends, let us now learn some important points about the opioids. So in the opioids, first opium. So first opioids are derived from a plant which gives opium, that is Papaver somniferum. So opium is derived from a plant, that is Papaver somniferum, that is mainly the poppy plant. It is poppy plant. So in the opioids, first we have to learn about morphine. Then second, opioids include morphine, heroin. Heroin is diacetyl morphine. This heroin or diacetyl morphine is the most commonly abused opioid. This heroin is a lipid soluble. It is more lipid soluble than morphine, and it has rapid onset of action, and it is associated with some adulterants. This heroin is also called as smack or brown sugar. This heroin is also associated with some adulterants, like it is associated with starch, quinine. That is, this heroin is added to this starch, quinine, chalk powder, paracetamol and talcum powder, and it is taken up by the patients. Then if you see the routes of administration, initially the patients will take it orally or IV or subcutaneously. Later the patients can also snort it, that is through intranasally. If it is taken through intranasally, then we call it as chasing dragon. Then some patients also take it as injection route, that is via the peripheral veins. Later, if peripheral veins are not available, then they go into the larger veins, which is called as main lining. Later, if larger veins are also not available, then they start taking the drug subcutaneously, and this is called as skin popping, because the skin popping, this is mainly because they do not find the veins. Then if you see on intoxication of opioids, the patients will have, on opioid intoxication, the patients will have feeling of euphoria. The patients will have feeling of euphoria, warmth, heaviness of extremities is seen. There is feeling of euphoria, warmth, heaviness of extremities is seen. The patient has facial flushing also. There is a phenomenon of nodding off, where you see initial euphoria along with a period of sedation. There is initial euphoria with a period of sedation is seen. Then we have about opioid overdose. Then if you see the next we have opioid overdose. So whenever there is opioid overdose, the patient will start suffering from respiratory depression. The patient will have slow respiration, hypothermia, there is hypotension, bradycardia is seen, pinpoint pupils are seen, and even cyanosis is seen. All these will progress to development of coma. Then if you see this is seen in opioid overdose. If you see the withdrawal symptoms, there is rebound noradrenaline overactivity is seen to withdrawal symptoms. There is rebound noradrenaline overactivity will cause the withdrawal symptoms, right? So if I rebound noradrenaline overactivity leads to the withdrawal symptoms. So the withdrawal symptoms include there is flu, like the patient suffers from. Before that we will draw a graph. This is last dose from from last dose. The time line from last dose is plotted on the x-axis, and the symptoms are plotted on the y-axis. So you will see that the symptoms will start in 6 to 8 hours, and the symptoms will peak in 2 to 3 days, and they will subside in 7 to 10 days. So symptoms will start in 6 to 8 hours, peak in 2 to 3 days, and subside in 7 to 10 days. Then we have to learn about the withdrawal symptoms. In the withdrawal symptoms, the patient will have flu-like syndrome. There is lacrimation, rhinorrhea, sweating, diarrhea is seen, and the patient has yawning. There is history of yawning, piloerection, and pupillary dilatation is also seen. Yawning, piloerection, pupillary dilatation is also seen, along with muscle cramps, body aches are seen. The patient also might have insomnia, anxiety, hypertension, tachycardia, nausea, vomiting, anorexia are seen. All these are the withdrawal symptoms which are seen due to opioids. Lacrimation, yawning, piloerection, pupillary dilatation and tachycardia are most important. Then if you see the treatment now, the treatment includes, in the treatment first we have detoxification. So in the detoxification, first first we can do the detoxification without any drugs. No drugs can be used for detoxification, that is, no drugs are used for detoxification. This is called as therapeutic community or cold turkey. That is, without drugs, only with some community issues we can detoxification can be done, but that is not generally practiced. Most commonly we do pharmacological detoxification, where we substitute the opioid with long acting harmless opioid drugs. So the opioid drug is substituted with long acting less harmless opioid drugs. So this opioid drug can be of two types. One, it can be methadone, and second we have buprenorphine. So in the methadone can be used mainly in the world as methadone maintenance clinics. So the places where this substitution is done is methadone maintenance clinics all over the world. It is mainly in the world, but in India we have buprenorphine maintenance clinics are seen. In India, buprenorphine maintenance clinics are seen in India. So the main principle of using this substitution therapy is harm reduction approach. So we are giving the patient the pleasure he needed, and we are also supplementing it with a harmless drug. So that is, harm reduction approach is the principle for detoxification. Then if you see, the other drugs which are used include the other drugs like propoxyphene, dextropropoxyphene are also used. Other drugs like propoxyphene, dextropropoxyphene are also used. Then if you see, this substitution is done for a period of 2 to 3 weeks. Then we have the third type, the third one, which is symptomatic treatment. So symptomatically we can give drugs like NSAIDs, loperamide, clonidine, which is an alpha 2 agonist, is also given. This clonidine, which is an alpha 2 agonist, will decrease the sympathetic drive, and thus it will decrease the withdrawal reaction. Then we also have accelerated detoxification can also be done. So the next thing is acceleration detoxification is also done. In accelerated detoxification, we give low dose of naltrexone is given. This naltrexone is given for a duration of 4 to 5 days. That is, the detoxification is done in a faster time, because in buprenorphine or methadone we require at least 2 to 3 weeks of duration, but here 4 to 5 days is sufficient. Then we have relapse prevention or maintenance treatment. In maintenance treatment, we mainly give opioid antagonists. That is, we give opioid antagonist, that is naltrexone is given. This is the drug of choice for relapse prevention. Opioid antagonist naltrexone has a half-life of 96 hours. That is very long. So because of this longer half-life, we use it in maintenance therapy. We also have some non-pharmacological approaches like cognitive brain therapy or narcotic anonymous, which is similar to alcohol anonymous, which is a group, self group, which will follow 12 steps to quit opioids. Then if there is any overdose of opioids, In such cases, we will have to give the drug of choice is naloxone, which is also an opioid antagonist, but the half-life of this naloxone is only half an hour. Because it is short acting, we use it for overdose of opioid. So in this case, tolerance does not develop to meiosis, constipation and convulsions. So this is about the opioid toxification for opioid addiction. Thank you for watching.